We've got time now just for some questions that have come in as we've been on air and have come at us rapidly. So we're going to pass them right on. Anybody can jump on any of these as they see fit. We know there are 3 vaccines out there now. The Pfizer vaccine that everybody is familiar with, the Moderna vaccine. These are both 2-dose vaccines. We were told by Dr. Williams today that the Johnson & Johnson vaccine will be coming our way in March, and that is a single-shot vaccine. Some confusion in the minds of many, I am sure. We don't really have a choice, but which of those 3 vaccines do you guys like?
Any vaccine in the arm is a great vaccine, and at this point, all the vaccines are actually a lot more efficacious than we thought that they might be when they were in development. So, you know, we should be dancing in the streets. All of these vaccines are a good choice, and if anyone is offered the opportunity to get a shot, please do not turn it down. Don't wait for a specific product or a specific brand. They're all safe, they're all effective, and the one that you can get is the best one that you can get.
We'll just keep these going, Dr. Haight. How long after my 2nd dose am I considered immune? How long does that take?
For most of us, 2 weeks after our 2nd dose of either the Moderna or Pfizer is when we're maximizing the antibody response that we're looking for. And so that's generally what we'll say is 2 weeks after the 2nd shot. And that would be true of the Johnson & Johnson about 2 weeks after that, once we do have Johnson & Johnson available to this area.
We know that we don't really know how long the immunity lasts, so do we know when we're all going to have to start over and go back and get more shots? Dr. Haight?
So the answer to that question is we don't know. Again, I think Dr. Morris mentioned earlier that after we have people that have had the vaccine for over 6 months and their immunity continues to do well with other vaccines, such as measles, mumps, rubella, after you've gone through your series, those continue to go very well. So again, we would expect the same, but as time goes on, as more of us have been vaccinated, we'll know more about what we need to do in the future, whether it's revaccination or if this will be good for all of us at this time. So again, time will tell us, studies will tell us what we will need to do in the future.
Dr. Morris, some people want to know about reaction to the shot itself. We know they keep us sitting around for a few minutes to see if there is anything immediate, but in terms of anaphylactic COVID reactions, when should I expect those to occur? How long before I'm in the clear?
Well, luckily, those types of really serious reactions are very rare, very rare. So some of the data that have been published show that those reactions happen, you know, a few times out of a million, right? So not very often at all. And when they do happen, they happen very quickly. So it's what's known as an immediate hypersensitivity reaction, and that's exactly when it happens, is immediately within a few minutes, and certainly within a short period of time. It's not going to happen days later. It's not going to happen that night when you go home and go to bed. So that's why we recommend observation for 15 minutes for almost everyone after they get their vaccine, and for up to 30 minutes for anyone who has had a serious allergic reaction to maybe a different vaccine or a serious allergic reaction to something else in the past.
Let's talk about expectant mothers or women who are considering getting pregnant. And there's a bunch of questions attendant to that. Should I have the vaccine if I am pregnant? Dr. Morris?
So I provide prenatal care. I take care of pregnant women and babies, and the answer to that is yes. Actually, the state of Missouri considers pregnancy to be one of the high-risk groups that's in the Phase 1B Tier 2, and the reason for that is that pregnant women may be at an increased risk for severe COVID. And so certainly women who fall into those maybe high exposure categories like essential workers, healthcare workers, but just pregnant women in general should strongly consider, I would recommend getting a vaccine because that helps protect you. And you are actually more than one patient. You are two patients, and you're protecting your fetus, your baby, by protecting yourself. So there is not a lot of data about long-term effects, but we actually don't expect there to be long-term effects. Vaccines given in pregnancy are traditionally found to be very safe. The influenza vaccine, for example, is recommended to give to women if they're pregnant during flu season because similarly, influenza can have bad effects on mom and therefore on baby. And the bonus is that a pregnant woman who gets vaccinated, those antibodies will cross over, they'll protect her newborn baby, and if she breastfeeds, they'll continue to protect the baby through breast milk as well.
So there's no prohibition during the nursing period. You don't have to wait until you stop, I would assume. Dr. Haight, I'm running through these as rumors. Will it make you sterile? Can you still have children?
So the answer to that is it will not make you sterile, and yes, you can have children after you have the vaccine. So those are completely unfounded rumors, and so again, we encourage people, if they qualify, regardless of what they are planning for children, to go ahead, please go ahead and get the vaccine.
And people want to know about accessibility down the road. Once everybody has had it once, is it going to be easier to get it? I know that's a crystal ball question, Dr. Morris, but give it your best shot.
Yeah, if I had that crystal ball, I don't think I'd be sitting here talking to you folks tonight. I think that is a great question, and I also think we should trust in our infrastructure, right? So this is warp speed, and it actually happened at warp speed. So I think we need to give some credit to medical scientists for getting this going as quickly as they have. And the supply and demand mismatch that we have right now is purely a product of timing. And I think that in the future, you know, every year we can produce hundreds of millions of doses of influenza vaccine, for example. And in fact, we have extra, and we're always looking for folks to give it to. So I think we're going to be in a similar situation in the future, that supply chains will improve and will increase production to be able to meet that demand if we need that for booster doses in the future.
And before we move on, we want to wrap up and give the physicians a chance each to kind of wrap up and give us their final thoughts on the vaccine. Dr. Morris, I will start with you, but I want to make sure I ask this important question. Somebody asked, how much does each dose cost? Are you going to charge me when I get the vaccine? We haven't talked a lot about that quick throughput center at Furrow Field and how that works. Want your final thoughts, but we're not going to ask for money up front, correct?
We are not asking for money. This is a vaccine that everybody, including your state government, your federal government, the healthcare system, everyone wants everyone to get. And so certainly cost is not an issue. No cost.
Final thoughts, Dr. Morris. I took part of your time, but do you have anything else you want to add?
I am so glad that we've had the opportunity to talk about the vaccine in this way and to really get some of those questions answered. I think my job as a family physician is a lot of education with my patients, and I feel really strongly that this vaccine is safe and efficacious, and I'm glad that I've had a chance to dispel some myths and give folks some good information. Now get signed up and get your shot.